Good evening. I call the August 6, 2020 meeting of the Johnson City Board of Commissioners to order. As you will notice, we are meeting electronically again. And so, Ms. Jennings, would you call the roll of the commissioners?
Commissioner Calhoun.
Present.
Commissioner Fowler.
Here.
Commissioner Hunter.
He's
Vice Mayor-
muted.
He's muted. Vice Mayor Wise.
Present.
Mayor Brock.
Present. Thank you. This evening, we are honored to have Pastor Jim Powell from Christ Community Church to deliver our invocation, and that will be followed by the pledge. Pastor Powell.
Ma'am, thank you. Let's pray together. Lord, we invoke you on behalf of this commission. We invoke you on behalf of the city of Johnson City, Tennessee. And Lord, we just thank you that you've determined allotted boundaries and times where people gather in communities. And this is the time and space for these leaders. And this is a time and space for us as citizens. And so, Lord, I just ask for wisdom. I ask that as you put us in places to seek the welfare of the cities where you've sent us, Lord, I pray for these commissioners that they would serve for the welfare of the people. Lord, these are complex times, and I pray particularly for wisdom, for discernment. I pray for the families of these commissioners and other leaders represented on this meeting call, as well as across Johnson City, from Public Works to the city manager's office, to the mayor's office, to law enforcement and safety. Lord, would you protect the leaders of this community? Would you grant knowledge and discernment that is appropriate for these times? Lord, would you grant courage? Would you grant favor? And Lord, we just ask that as the meeting progresses tonight, that you would see fit for the deliberations and the conversations to bring resolution or to bring direction where there's direction needed. And so, Father, I thank you for these people. I thank you for the family that I have that gets to live in this great city, in this place. And I ask that you would enable the commissioners on this meeting to glorify you in all that they do. And we thank you for the grace of the gospel by which we stand and by which we can be at peace. So bring peace to this city and to these leaders, I pray in Christ's name. Amen.
Amen. Thank you, Pastor Powell. Thank you very much. We now will have a flag on the screen. I pledge allegiance to the flag, to the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Peterson, I will turn the meeting over to you to get us going. You're on mute.
I've asked Dr. Kirschke and Eric Deaton with Ballard if they would give us an update on the COVID situation right now. So, Mr. Deaton, if you would, I think you've got a couple of slides to share and an update from Ballard Health, please.
Did you all get my slides that I sent to you?
I did. Let me send those to Wendy. And Dr. Kirschke, you want to go ahead while I send these slides over, and we'll come back to Mr. Deaton.
Okay.
Sure. So I just wanted to share a couple of things. One is testing. So we continue to do a lot of testing at the Washington County Johnson City Health Department. We're averaging over 1,000 tests a week there. The turnaround time, luckily, on the test is getting better. Still not ideal from a lot of the labs, but our lab, it's at least improved somewhat. It's probably between 2 and 4 days for us getting results back. Across the region, we're testing about 3,800 tests a week, and again, over 1,000 per week in Washington County, Johnson City. Cases remain high, so it's a little bit up and down every day, but in general, fairly high. And as I'll talk about in a minute, Washington County and Johnson City are considered in the yellow zone on the White House's report. Well, actually, so we can talk about that now. Is it possible for me to share my screen? I'll try to do it and see what happens.
Yes, you should be able to.
So are you seeing Tennessee state report?
Yes.
Okay. So this is the White House's report on Tennessee dated August 2nd. So it talks about the state situation, some interesting things. The White House does recommend Tennessee implement state mask requirements statewide, and to limit social gatherings to 10 people or fewer. They talk about trying to increase testing, messaging to residents about social distancing. But if we go down to the who's in the, so it goes by county, red or yellow. So red being, the worst affected counties or cities, and yellow being the kind of the middle zone. So Johnson City's in the yellow zone. So we can go down and see what the White House recommends for counties in the yellow zone. So talks about wear a mask at all times outside, limit social gatherings to 25 people or fewer, don't go to bars or nightclubs, use takeout, outdoor dining, or indoor dining when strict social distancing can be maintained, protect people with serious medical conditions, reduce your public interactions and activities to 50% of your normal activity. So again, these are things that the White House recommends for cities and counties in the yellow zone. It talks to public officials about limiting gyms to 25% occupancy and closing bars. So this is obviously more restrictive than what's going on or what the governor or other leaders in the state have recommended. But this, again, is in the White House report to states. Limit social gatherings to 25 or fewer if you're in the yellow zone. This we're already doing is weekly testing of workers at long-term care facilities, ensure businesses and retailers require masks and can safely do social distancing, increase messaging for individuals that are at high risk. So anyway, this report is publicly available now. It is out there through some media sites, I believe. But again, that's the White House report. So we are seeing cases in all kind of segments of our communities. Some of our counties with lower populations are getting a lot of cases now. We're seeing cases in lots of cases. Again, the largest group is that 20 to 30 age group. Most of our cases are occurring in that age group. So with college coming back, obviously that's a concern. But the other age group we're starting to see more cases in is that school age group of 10 to 20. So we're seeing there's a large outbreak associated with a Young Life camp in North Carolina close to here. And we're having lots of kids coming back from that camp positive all across the state, many in our region. And those kids are coming back and they're going into sports practice and things like that. So we've had lots of sports teams like high school and even middle school sports teams affected by that. And again, we're seeing cases associated with nursing homes, continue to see cases associated with healthcare, restaurants. Some of our large businesses are having cases. So it's really community spread. And there is, we just want people to know that there's risk anywhere you go in our community, that you should take precautions, including make sure you're wearing your face mask and doing other things to reduce your risk and stay healthy.
Okay. Thank you, Dr. Kirschke. Any questions for Dr. Kirschke at this time?
I guess I'd have one or two, I guess. Dr. Kirschke, with
with the younger populations, I mean, obviously age is an interesting component of tracking this, but are we seeing that there's any relation to, other factors other than just age, like, and also related to the severity of when they contract it at a younger age? Are we seeing that they're recovering quicker or a higher percentage recovering than older ages, or are we seeing that they're more likely to be hospitalized? Or within the age brackets, is there more than just age? Is there comorbidities? Are there, health factors that are also kind of tied into, the severity of, their cases at these different age brackets?
Yeah, so fortunately, most of the younger people are not ending up in the hospital. I'm not really aware of anyone in the school age category from our region, at least currently, that's hospitalized. So a lot of these school age kids can be asymptomatic, which is good for them, obviously. But in terms of spreading it, it's harder to detect. And that's also mostly true in the 20 to 30 year old people. So there, again, lots of asymptomatic spread, but if they do have symptoms, it can be mild. Not totally, like some people get fairly sick, but typically aren't requiring hospitalization. But across the state, there are hospitalizations and even deaths in all of those age groups. But I think that one thing is that there's just a lot of social interaction among children that age, whether it's in sports or some of them have, started back some school activities, the college age kids, like there's been health related studies going on in our universities, and we've had some outbreaks among those classes. I don't know, I say like, especially that college age group just have more interesting lives than we do. So they have a lot more social interactions and a lot more contacts. So lots of chance for spread.
Do you have any numbers for today, or will that come out tomorrow as far as positive tests?
I don't know the numbers. Yeah, I don't know the numbers for today. I guess we'll have to wait for tomorrow to see that.
Thank you.
Dr. Kirschke, you mentioned 3,800 tests being done in the region. If 1,000 of them are in Washington County, are the other 2,700 then in the other 3 counties you serve, or what territory is that 3,700?
Yeah, so that's our health department is 7 counties in Northeast Tennessee, not including Sullivan County. So basically Hancock, Greene, and Hawkins East,
Okay.
subtract Sullivan County.
Thank you.
Will we be able to start getting numbers that really begin to isolate Washington County and Johnson City? Particularly as these college students maybe come back in here, how we can track what's happening right here. That's the influence that we have. Is there any way to slice the data anymore so that granular, so we can see how we are doing?
Yeah, so actually we have an epidemiologist that we hired with coronavirus funds that is actually working on specifically school aged ones. So that's, primary, secondary, and college age kids. So he is trying to mine some of the data. It has not been that easy to get at all that data, but we are looking for ways where we can have reports. They are developing reports specific to the schools. So we met with all the school superintendents yesterday by a WebEx meeting and did provide some school county level data on school age kids to them. And we'll continue to do those meetings with the school superintendents on a weekly basis on Wednesdays. We also have asked for a point of contact with all of our schools so that we're going to actually train them on how to respond to cases in the schools and how to do contact tracing to assist the health department when they inevitably get cases in the school when kids return.
Dr. Kirschke, sorry, Dr. Fowler earlier this week had a question, and if I ask it incorrectly, Dr. Fowler, feel free to step in. But I think the question he had was, are we tracking double testing? So if somebody came in and tested, and then are they getting double counted if they come back in later, or are they pairing that out somehow?
No, we are separating that, but that is one of the challenges with trying to look at the data is getting rid of those duplicates, because some people get tested, 5-10 times, especially healthcare workers and nursing home staff and things like that are getting tested weekly. So yeah, we are having to get that out of the equation.
But the one thing to remember, John, is that the positives are only counted one time. So we are pretty sure that we're not counting positives twice. Is that right, Dr. Kirschke?
Correct.
Yeah.
Yeah, I figured that would probably create a higher negative, because somebody keeps thinking, I think I might be positive this time. I might be positive this time, and just increasing on that side. Yeah.
So because Washington County is showing up in the aggregate numbers region-wide, we seem to be kind of a hot spot over here. Being able to slice and dice through these numbers would be really helpful. And because Johnson City is the most density within Washington County, would have to, assume, I guess at this point, that we're kind of a hot spot here. And then again, with the university, that would add to it. So the more we can get targeted in terms of anything we can do for interventions, or to, work with different groups to make sure they're wearing their masks, they're doing what we can do to help turn those numbers around. That's certainly what we want to do. But I just want to kind of repeat what I think you said about our younger elementary school age children, that while they may contract the virus and it may be mild or even asymptomatic, one of the real concerns is they become carriers to transmit it then to back home, to throughout the school as well. So those are some of the reasons why we need to keep them separated as much as possible.
Yeah, so one of the big question marks really is how much they will transmit it. So some early data, we thought maybe there would not be a lot of transmission among the younger kids, and then not as much transmission for them bringing it home. But there was a recent study of a large summer camp in Georgia where about 50% of all the attendees from, I think, age 10 up to 18, 50% of the kids, it was like 500 kids, 50% of them became positive for coronavirus, and then obviously traveled back to all the places they came from. But the real interesting thing from that would be as if they followed them home and kind of looked at what happened in the household when the kids returned home. Did it spread to everybody in the household or not so much? That's really part of what we don't know in terms of evidence for what's going to happen when school starts back.
Are you seeing any evidence at all of now that we're wearing masks more, and I do have mine here, but no one's around me. When do you think we may show up? It may show up in our numbers.
I'm sorry, repeat that.
I said now that more people are compliant wearing masks, and
oh yeah,
when you go into the community, we really see it. We are hopeful it's going to start showing up in our numbers. Are you seeing any evidence at all of it?
Yeah, I think so. It's hard to parse out what's, we have seen a little bit of a tapering of the number of cases, so they have not continued to increase at the same rate they were a couple of weeks ago. And I think the hospital data probably shows that as well. We'll hear from Eric in a second. So I think it's definitely helping. It's impossible to say, to what extent, but I think between masks, one thing is I think masks make people safer in a lot of different ways, because it's just a signal to other people about social distancing. Not only does the mask help you from spreading your germs to other people, but it's a signal for people to stay farther away from each other. It's also a signal when people see everyone wearing a mask you don't really want to go into a crowded space where everyone's wearing a mask. It's just a visual signal to remind us about social distancing. So I think the masks help in a lot of ways.
Thank you, Dr. Kirschke. Pete, did we get the visual aids in place now?
Yes, ma'am.
Okay, well, we will introduce Mr. Eric Deaton again from Ballad Health. And Eric, thank you for coming. We appreciate it. You've been very good to keep us informed. And so we'll turn it over to you.
Thank you, Mayor Brock. If you want to bring the first slide up, Wendy, I don't know if you have it or who's going to bring that up. You can go ahead and advance from there. Okay, so we are able to mine some data for just Washington County. We can't drill down to Johnson City, but we can get Washington County data. So this is state reported data through 8/5. And since March, when we really started tracking this, we've had 1,114 cases in Washington County. We've had 2 deaths, 52 hospitalizations. In the past 7 days, we've had 274 cases just in Washington County. We've had no deaths in Washington County, people from Washington County, and then we've had 8 new hospitalizations from Washington County in the last 8 days. We've also, one thing that's probably been alarming to us is the percentage of positive cases that we've seen overall. And Dr. Kirschke, you might want to correct me on this, but I think the state is probably running around 7% or so positive. The overall for our 21 county area that we serve in Ballad Health, it's 10.9% positive right now. And actually that Washington County number is at 10.9. We looked at that again later this afternoon. And so our positive rate is in Washington County is equal with what it is across all of our Ballad Health service area. And so, and it is higher than the state. So we are a little bit of a hotspot, as you said, Mayor, from that perspective. You can go to the next slide, Wendy. So pulling data, these are,
Eric,
yes.
sorry to interrupt, but back to that last slide, I do have a question.
Okay.
Correct me, because I'm not sure, I don't look at this all the time, but the positive rate, that's a function of the number of positive tests out of the total number of tests taken, correct?
That's right. So to your point earlier, if there's a lot of negative or a lot of people are retaking a test over and over again, it could actually be higher than that. Right.
So with our region being so heavily medical focused, with having, a large health system and, a large majority of our people that either work for healthcare or related to somebody that works in healthcare, do you think that that's not necessarily a bad thing? It's that people are identifying before they even show up for a test more likely, and so that when they come into it for a test, they're actually showing symptoms and signs and not just going because they went to the grocery store?
Yeah, I think we're seeing both. We see people who they think they've been in contact with someone, or they feel like they just want to be tested. I will tell you that the test is not a fun test. So it's not something that somebody wants to get done over and over again just for the sake of having it done. So I don't think that there's a lot of people doing it just to be getting tested. The people I talk to usually are symptomatic, or they have been in direct contact with someone who has been a positive COVID case. So I don't think there's a lot of repeats out there, but there are some of that. There is some of that. This slide pertains to the state reported number of cases by week for Washington County. You can see very early on we had hardly any, and this relates to the stay at home for Tennessee and for Virginia. And then this is interesting. We added on here the Washington County mask mandate went into effect, and we did that so we can kind of start seeing, to your question earlier, Mayor, about when we start seeing some effect of the mask mandate. So, we're about week 3 right now. So you would think we'd starting to see some leveling off. I think Dr. Kirschke did say we are seeing some leveling off now. So I do think the data that we're starting to see very, very early on, that we are starting to see some leveling off of positive cases. So that could be an early indication that the mask is working. And I think that the mask wearing does clue people into the other things about washing your hands and, social distancing and things like that. So we're very hopeful that the mandate will start kicking in here very soon. Wendy, you can go to the next slide if you like to. And then we wanted to look at an age distribution just for Washington County. And so you can see, obviously, it's the 21 to 30 range by far that really is where we're seeing majority of the cases for Washington County. And that makes sense. That's where our colleges or larger colleges located, university. And so only 4% of very young children, and then older adults, 81, only 1.6%. Typically, we've seen that the older adults are paying attention to things and staying at home and doing all they should be doing. But that younger age range, again, of 21 to 30, is typically where they they feel less vulnerable, and so typically would be testing positive. Wendy, you can go to the next slide if you like to. And then this is looking at just Washington County. We're doing a daily update. I think hopefully you all are getting this daily update just for the entire region, but this is just for Washington County. So we pulled out the data, and right now, number of patients in our hospitals in Washington County, there are 26. There were 3 PUIs this afternoon from Washington County. Those are the patients under investigation who have been tested, but we don't have results back yet. We have 21 designated beds in Washington County. So why is there some more beds? And we actually have some patients that are in intensive care. They're not counted into those 5 are actually ICU patients. They're not counted into the 21 bed designated. So that's why that number doesn't match 21 and 26. But when you add those together, we are full with the number we have in Washington County right now. That fluctuates day by day. And obviously, we have right now about 45 to 55 beds available across the system. And we continue to increase those based on our needs. And again, by moving staff around, we've been able to create capacity across the region. And there's 3 people on a ventilator right now within Washington County. And you can see back up to the bed availability is at 65 right now across the whole system. Wendy, I don't know if there's another slide or not. I think that was it. Just a couple other things I'll say is of the COVID cases originating from Washington County, it accounts for about 17% of the total cases across our region that we look at, and 12% of the hospitalizations. In the past 30 days, Washington County ranks 10th in the state of Tennessee out of 95 counties for COVID growth rate. So it's pretty significant right there. Locally, only Hancock and Carter counties have had faster growth rates in Tennessee for the past 30 days. So, and then one other thing I'll share with you, this is not pertaining to Washington County, but overall in the service area, we've had 71 deaths since the 1st of March. In the past 7 days, we've had 17 deaths that we've accounted for, and that's 24%. So almost a fourth of the deaths that we've had have been accounted for in the last last 7 days. So that's the scorecard we're sending out. And hopefully, if you're not getting this, let me know, and I'll make sure that we're trying to send it out to as many people who want to see it. And we update this every day at 11 o'clock. So it shows the total number of positive cases across the system since March, the number of deaths we've had, number of deaths since in the last 7 days, and the positive rate for the past 7 days. That red arrow indicates that that's increased day over day. So today we had an increase from yesterday. And then it shows the number of total COVID patients in beds, 93. We have 34 that are patient-centered investigation across the system, 65 beds available today. And then the number of patients that are intensive care across the system that have COVID-19, and then the number of patients that are on a ventilator. So again, we're sending this out every day at 11 o'clock. So hopefully you're getting that information. That's all I've got if there's any questions.
Thank you. Any questions for Mr. Deaton?
Mr. Deaton, I got a couple.
Okay.
Great info. And I do get that last, Wendy was able to share that last slide that comes out at 11 every day. And I was looking at that earlier today. And one of the things that I'd like is, you know, the arrow that shows up or down for that one metric. I think that the ICU and the ventilator, I'd love to see an arrow is, you know, if we've gone up or down on that. Again, it's no big deal, but I thought it would be interesting and possibly useful.
That's easy. I'm happy to do that.
And then I've had a couple people in the community ask, you know, why are there COVID beds in different hospitals where, you know, when the merger happened, you know, there's been some centralization of, you know, for better efficiencies, whether it's the heart hospital or whatnot. So I guess their question was, why is COVID with its ability to spread, centralizing that so that, you know, there's less risk of spreading it within multiple hospitals?
Yeah, that's a great question. We really approach this by market because, and I'd say the southern market, northeast, northwest, and that's where we have our 3 larger tertiary hospitals. So in Johnson City, for example, the southern market, which covers the Johnson County all the way over to Greenville in that area, so it's a very large region. We designated beds at Johnson City Medical Center. Greenville has a few beds, and then Sycamore Shoals has a few beds. The reason the majority of the beds are at Johnson City Medical Center, they had the space was one thing that they had, but also these patients can go downhill very quickly. They can decline very quickly. So what you want to do is oftentimes have the capability for a lot of specialties, especially around pulmonary and critical care. So there are patients that have declined within just a couple of days and actually have passed because the decline happens so quickly. So we've tried to make sure that we have capacity in our tertiary hospitals and that we have the backup of the really intensive care units and of the physicians who treat the critically ill patients to help care for them. So majority of the beds, COVID beds we have designated are at Johnson City, Bristol, Regional Medical Center, and Holston Valley. And they've been by region because people come from, obviously, like someone comes from Smith County, they would probably end up going to Bristol for their care.
And then I guess my final question would be, you know, we break out positive rates by age brackets. Are we doing that as far as reporting deaths and hospitalizations as well to break out by age range?
We do. We have,
or is that a HIPAA thing?
Well, we have it by, we track it internally, but we felt like that putting that out may be a little bit too much data about particular patient, especially as the numbers get really small. It's difficult to put some of that out.
Sure. Yeah.
We do track it.
The risk of HIPAA violation, I guess. Right?
I will say the majority of the deaths that we have seen have probably been more towards the older population, obviously.
Sure. Absolutely. Thank you.
Yes, sir. Thank you.
Any other questions from commissioners? Okay. I have one final for Mr. Deaton and for Dr. Kirschke. What is your best advice to us as a city? We have school officials on the call tonight. I think some are listening in. If we could only do one thing right now, what would it be to help us get, to mitigate the spread And that's, I guess, our ultimate goal.
Dr.
You're on
Kirschke,
mute.
you're on mute, I think.
Thank you. So I was going to say, really, I think masks are probably our single best tool currently in the community. And if we want schools to be successful, it can't just be the schools doing the right thing. It has to be the whole community, adults and kids doing the right things. So I would say that's probably the single most important thing. Of course, masks don't work by themselves and it has to be in conjunction with other things. But in terms of something to focus on for the community to get kids safely back in school.
Good. Thank you.
Yeah, I think Dr. Kirschke, obviously, he's much more of an expert than I am in this. And I totally agree with what he's saying and appreciate all the work that the health department does. Only thing I would add would be, I know a lot of the schools are putting plans into place around sports and things like that. And I think it's especially for social distancing. So besides masking, social distancing, I think is going to be really key. And as you put plans into place, I think you need to follow through on the plans and make sure people are following the plans. So if you put a plan in place for, say, a football game or something like that, where people are distancing at the game, I think there needs to be some sort of policing of that to make sure that people are doing what they're being asked to do, so we can keep these things going on. So,
Very good. Thank you all so much for joining us tonight. And perhaps in a couple of months, you won't have to dial in anymore. That would be nice.
thank you for having me.
Thank you.
Thank you.
Mr. Pete.
Thank you.
Thanks.
Okay, Pete, we'll turn it back to you.
Okay, your first order of business is consideration of the approval of the minutes of your meeting held on Thursday, July the 16th.
Move approval.
There's a motion. Is there a second?
Second.
Okay, any comments on the minutes? If not, Ms. Jennings, call the roll.
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Next is the presentation of a proclamation recognizing suicide prevention awareness. Mayor?
Okay. Is there anyone who is in the Zoom meeting that was bringing this forward that I could recognize? Okay, I will read this proclamation. Whereas suicide is one of the most disruptive and tragic events a family and a community can experience, with more than 1,100 lost lives in Tennessee each year, and an estimate 25 attempted suicides for each suicide death. And whereas suicide is the 9th leading cause of death in Tennessee and 2nd leading cause of death among young ages between ages 10 and 24, and the 1st leading cause for children ages 10 to 17. And whereas more than 3 lives a day are lost to suicide in Tennessee, which means we lose 22 Tennesseans each week and 97 people per month. And whereas Tennessee veterans, active duty military, and National Guardsmen face a disproportionate risk as compared to the general population, with more dying from suicide than combat. And whereas public awareness of this tragic problem is the key to preventing further suffering and loss of life, and the risk for human self-destruction can be reduced through awareness, education, treatment, and the highest risk for suicide is among the survivors of those who die by suicide and those who have attempted suicide. And whereas suicide prevention has been declared a state priority by the governor, and the Tennessee legislature has declared teen suicide prevention as a state priority in partnership with the Tennessee Suicide Prevention Network to implement the Tennessee Strategy for Suicide Prevention. And whereas Tennessee is the national leader in the effort to prevent suicide, being one of the first states to develop a suicide prevention and evaluation plan covering the lifespan. And whereas the governor of Tennessee has appointed a Suicide Prevention Network Advisory Council to coordinate the implementation of the Tennessee Strategy for Suicide Prevention. And whereas the Tennessee Suicide Prevention Network is a grassroots collaboration of Tennesseans and organizations working to eliminate the stigma of suicide, educate the community about the warning signs of suicide, and ultimately reduce the rate of suicide in our state. And whereas 2020 marks Suicide Prevention Network's 20th year of dedicated efforts to reach every Tennessean in every county. And whereas every member of our community should understand that throughout life's struggles, we all need occasional reminders that we are all silently fighting our own battles. And whereas we encourage all Tennesseans to take the time to inquire, as it is the well-being of their family and friends, to genuinely convey their appreciation for their existence by any gesture they deem appropriate. And to remember that a simple phone call, message, handshake, or hug can go a long way toward helping someone realize that suicide is not the answer. Now, therefore, I, Jenny L. Brock, Mayor of the City of Johnson City, do hereby proclaim September 2020 as Suicide Prevention Awareness Month. We do this proclamation every year, and usually we have members of one of the advocate groups who come, and they do several events to bring awareness. I'm sure with COVID, their events probably have been altered to some degree, but we want to keep them in our thoughts and prayers of with what they do to help bring the recognition that all families, all of our friends, we must, make sure we stay connected and see the signs that may be apparent that we could step in at a time to help prevent this. So anyway, thank y'all. And Mr. Peterson, let's move on.
Your next order of business is consideration of a beer license application for Bruce Miller Enterprises LLC, doing business as Max Dogs, located at 1709 Buffalo Road in Johnson City. This is an application for a Class 1 on-premise beer license. The appropriate reviews have been made, finding no disqualifying factors, and the recommendation is for your approval.
Okay, now that we are meeting electronically, is the applicant dialing in, or I can't recall handled it last time?
I'm going to defer to Wendy.
Okay.
I have no one on the line for that.
Okay. All right. So we'll have to do this differently. Commissioners, you've read the application. Is there a motion to approve it?
Move for approval.
All right. Dr. Fowler, is there a second?
Second.
Okay. Mr. Peterson, before we vote, since I'm not able to ask the applicant, have they, read all the rules and regulations about the sale of beer in Johnson City? Would you make sure that whoever gives them the certificate or the license does that for us?
Yes, ma'am.
Okay, thank you. Ms. Jennings, if you'll call the roll.
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes, ma'am.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Your next order of business is consideration of the consent agenda.
Okay, commissioners, are there items you would like to pull for further discussion?
I'm good, Mayor.
Okay, Dr. Calhoun,
None, thank you.
Commissioner Fowler,
None for me.
Vice Mayor?
Is now when we want to hear from the folks with the schools with
Yes.
respect to the technology piece and
Yes.
what we're planning there. I guess I would ask to pull, is that 6.3.1? Just for a little further explanation is all.
No, the numbering is, we've got 7.3.1, which is the Canvas Studio. That's one of them. And
Well, but it's showing up as a change order in purchases.
Are you talking about 6.41 and 6.42, the web-based curriculum courseware?
Yes. Yeah.
Yes, those are two items that were added at the last minute. We have Dr. Timms and Dr. Bentley here with us. So why don't you just address both of those, the purpose of it, and I think as much as anything, so the public can hear some of the additional things that you're doing to help assist with the online courses.
Sure.
I'll address the first one, Canvas Studio. Last year when we were in closure, I think most people know that Canvas has been our learning management platform that we use for all of our digital education for several years now. And after the closure in the spring, when a lot of districts across the country were struggling with the video component, Canvas actually added a new studio feature for not just our teachers, but for our students also, to record very high quality videos, both of themselves using external document cameras, being able to film themselves delivering instruction, and then also for the students to be able to film their own videos to upload back as part of their assignments. So this has actually created a digital studio within our learning management system. And all through the summer, our teachers have really been perfecting their method of being able to upload video instruction from themselves that students and parents can access 24/7. So that's the Canvas Studio portion of this request.
Dr. Timms, are the school systems receiving any additional funding from state or federal?
Absolutely. Several of these, in fact, all of these are being funded with our federal CARES money. We sat down at the beginning of the summer as a staff. I know Dr. Bentley can speak to this as well. And we really went through and prioritized what we felt like we needed to get in place on the instruction side to equip our teachers and, of course, equip our students. A lot of our CARES money went into the purchase of actual devices, both for our teachers and for our students. Like most districts across the country right now, we're waiting on our devices that we've ordered because they're in very short supply. So we have a lot of those devices coming, but both of these purchases are funded with our federal CARES money.
Dr. Bentley?
Our digital learning platform for K-5 we see this as an essential supplemental piece to our students. We have, as you know, we'll start full remote on Monday the 10th. We have moved away from the old hardback textbook in every subject for every student to carry home. So these digital resources are standards-based, curriculum-based. They're content delivery through platforms that students can easily pull up their Chromebook and access them with the assistance of the teacher. The digital learning, Partners for Digital, the strength of this for us, for our elementary students especially, is going to help bridge the gap, especially in social studies and science. We're very excited about the new English ELA textbook adoption that we purchased for K-12. Those resources are digital, so that will be the primary source of English language arts. We have an excellent math platforms for our students, but social studies and science for kindergarten through fourth grade is it's varied in different schools. It's very standards-based, but teachers use different tools and resources that are just not easily accessible through the remote system. So therefore, we have chosen to request to purchase this to help bridge that gap. But we're very excited about the platforms Dr. Timms has discussed. We're very excited. Our teachers have really just gone above and beyond this summer, and now just preparing that we're going to open with over 7,900 students working with us virtually from some location.
And I would add also the Partners for Digital. Part of our requirements from the State Department of Education for our continuous learning plan that we had to submit to describe both our hybrid, our fully remote, and of course our in-person approach required that our remote learning students have access to not just the 4 core subjects, but also to a PE and an art component. And Partners for Digital does provide those components for us, so that our, right now we have 40, you might be interested in some of these numbers, I've been adding them up. We have 40 kindergarten through 4th grade teachers who will be full-time serving remote students through most of this semester. We have 16 Indian Trail teachers, 12 Liberty Bell, 7 full-time at the high school, plus a multitude of teachers who are teaching both remote and in person. So we have a lot of personnel serving almost 2,700 students who selected to have their education remote for either a 9 weeks or a full semester, in addition to the full opening. So Partners for Digital was a real strong solution for us. It's a Tennessee-based company. We looked at some other companies, as did a lot of other districts in the region, but they really feel the need to get these materials in our teachers' hands quickly.
Good. Any questions for Dr. Bentley or Dr. Timms? I would like to say one thing, and Pete, I think you will join me as well. We attended the special call board meeting last night, but it really just the hundreds and hundreds and hundreds of decisions that are having to be made in our school system, and the adaptations that all of you have been through to kind of navigate through this unusual time that we're in. And I just want to take my hat off to the Board of Education, to the administration, and to the teachers who are having to adapt to this new world. And I think y'all have just done an amazing job. To the students and to all the parents, we're all having to pull together to make this work. So I just want to say thank you. As we said last night, we're having to make decisions on things where there's really no good answer. There's no good thing that you want to choose from. So it's been tough, but I could not be more proud of the elected leaders that are in place over on the school side, and with the direction that Johnson City Schools has taken. So please take that back, if you would.
Mayor, I've got a couple questions, and
Okay.
I would say I've heard that there's no good decisions. I've heard that, working with people at the hospital and stuff. And I'd kind of like to say that there's just no precedence. And quite honestly, I've talked to, and I can say this because I don't work in the school systems and I'm not on the school board anymore, but I've actually talked to administrators at other systems within our region who have been wowed and been very praising of Johnson City schools and quite honestly talking about how far ahead of the game our people are. So to echo your comments, Mayor, many kudos to you, Dr. Timms and Dr. Bentley and Dr. Barnett and all those that have, and all the teachers and the school board. Dr. Timms, you mentioned about the number of teachers doing remote learning and in-person learning and whatnot. Is that going to create, and I'm going to say once we get to that point, not if, but once we get to that point, is that going to cause any concerns or constriction of pupil-teacher ratios in person? Is it going to create a need for more staff or is it because we're going to have resources like that we won't need as many teachers?
I know Dr. Bentley can jump in here too, and I know Dr. Barnett's listening. We have spent many, many, many hours, haven't we, Dr. Bentley, looking at, mapping it out on giant boards, Mr. Hunter. And I can tell you that right now we are very, very balanced across the schools and really trying to maintain lower averages in person, simply because when we do come back, we want those lower averages in those classrooms. But amazingly enough, it has worked out very balanced. There's not a lot of wiggle room, but we're maintaining class sizes and not going over those. Dr. Bentley, anything?
No, I would agree. We are monitoring that hourly right now, Mr. Hunter, as we prepare to open on the 10th. So we're checking those things. But yes, our intent is always to balance those classes and not overload an individual teacher or a school.
Okay. And then y'all mentioned about the big shift from, I think, Dr. Bentley, you mentioned about, from the clunky textbooks to more electronic. What, if anything, at the state level is being done to accommodate that within the BEP formula where, I think when I was on the board at that point in time, the technology component or percentage, I know it's just a formula. I'm assuming Kathy Hall's watching, But I want to see that formula change to where, the technology piece that hasn't moved in a decade or two become more than the textbook piece of that component. So is there any talk at the state level? I know y'all are at that juncture, and then if so, and even if not, what are we doing as far as advocacy beyond just what the TSBA might be doing here locally to push that?
That's a great question. Of course, like many states, we've had very limited in-person contact with anyone, so we basically communicate with our core leaders and state department individuals. It was very clear in the fall, in the spring, once schools across the state began to send students home, the state jumped in very quickly with support through instructional materials digitally, even through the PBS and other stations. We've seen this shift over the last couple of years regarding moving away from what we would call heavy paperwork for students, and more of where it's they can show their work. The quality of work can come through digital platforms, through learning management systems, as Dr. Timms has talked about. I would say we're seeing a shift to where instructional materials can come in the form of paper pencil if that's what the district needs, but more focus on delivery in a more wide variety through digital. What we like about digital compared to just the textbook is when you purchase a textbook and it's bound and it's the good hardback, that it is in that form for 6 years. With digital resources, we continuously get upgrades, updates, more relevant and meaningful content added, and that keeps us on the cutting edge with information to our students. So that's one of the strong advantages. And then just cost. When we buy digital devices and we use digital platforms, we're finding it is a cost saving to our district and to the taxpayers.
Good, thank you. Okay, thank y'all for coming. Oh, you've got another one? Okay.
I'm sorry, Jen. This is one of the most important things people have been talking about for the past few weeks. And so just one more question, and Dr. Timms, I'm a big supporter of remote learning. I mean, we've worked on, or at least encouraged and supported your all's efforts at the high school level with a lot of things. But as we're dealing with elementary age and working families and obviously their needs are a little more intense in person. And with working families, and I just got our packet for our elementary child today, so I've not had time to read through the whole thing. But I know there's obviously going to be Zoom meetings and whatnot. Is there, but at the same time, people like myself and my wife and others will be attending Zoom meetings for work. So will there be flexibility and whatnot, or will they be recorded so that if they can't make that?
Great question. So that's one of the items on your agenda tonight with Canvas Studio. That's why that one is so important to us. We're emphasizing there's a great importance with the live sessions, but even more than that, we're emphasizing with teachers is that video content that you upload that is you delivering the instruction so that it can be watched at any time of day. I know Dr. Bentley and I have, and with Dr. Anderson, we've spoken with many parents over the last few weeks. And we spent the last 3 days with our 40 remote K-4 teachers. They will upload original video content from themselves, and then they will also record those live sessions and have those links available for parents to watch later in the evening or perhaps even the next day so that they can still participate and see the discussion that goes on with students. So absolutely, we will make sure that we have recordings of the live sessions available.
That's great news. Thanks, and sorry to keep you all here longer.
That's good questions, Commissioner. And thank you all again, Dr. Timms and Dr. Bentley, for joining us tonight.
Thank you all.
I have one question, Mayor, and this may be a Pete question. Dr. Timms made a reference to these were being funded out of CARES Act grant. And in the consent agenda, we've identified some of the items being CARES Act grant funded, but others are showing general purpose school funds. And I just want to make sure I'm understanding and reconciling those 2 points.
It could be, I would have to check with Leah Valley. Canvas Studio could be some leftover funds that we had in the digital component with the digital resources in the regular budget. But I know Leah is continually looking at how we're working our way through this. I do know that the Partners for Digital is definitely CARES, because that was an add-on expense that, like all districts, we had to find a digital content platform.
Yeah, that one shows in our packet as grant funded. The others are showing general purpose school fund, and I just wanted to be clear.
Vice Mayor, as I understand the CARES Act funding, all of that is eligible for reimbursement through CARES Act funding. Any expenditure that school system or general government incurs as a result of COVID is a legitimate reimbursable expense. And obviously any expense associated with remote learning is a justifiable reimbursement. So I'm sure that Leah is doing a great job of tracking those costs, and she will ask for reimbursement at the appropriate time.
So it'll just have to come out of their general fund and then get reimbursed.
That all of those CARES grant monies are like that. Most of them, not all of them, most of them are reimbursement basis. Yes.
Thank you.
Thank you. Anything else? All right, I think we go ahead.
A moment to brag on our district, as Dr. Timms alluded. Each school system in the state had to submit a continuous learning plan to be reviewed and approved, and we submitted ours and immediately heard back from the Tennessee Department of Education to ask if they could share our plan with other districts. It was so exceptionally done, and for our delivery of remote services for students. So I just wanted to share that. I thought that was quite a compliment from the Commissioner of Education.
Well, we wouldn't expect any less. So thank you for sharing that. Very good. Okay, commissioners, we need a motion to approve the consent agenda.
So moved.
Second.
Motion and a second. Any other comments? Ms. Jennings?
Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes. Okay, Mr. Peterson?
Next is ordinance number 4731-20. An ordinance to amend Title 8, Chapter 1, Section 101 by amending, adding 5 and 6, and renumbering and amending 13 and 14, amending definitions to the code of the city of Johnson City, to amend Title 8, Chapter 2 by adding Section 215, 1 through 3, authorizing the issuance of a temporary occasion beer license, and renumbering Sections 216 through 223, and adding Sections 225 through 227, which authorize delivery service license to the code of the city of Johnson City, Tennessee, to amend Title 8, Chapter 3 by amending Section 3012, 309, and 310, authorizing distilleries within the corporate city limits, amending Section 321, removing the requirement of certificate of compliance annual renewal with local government to the code of the city of Johnson City, or any other ordinances or parts of ordinance heretofore passed, is ready for your consideration on first reading. And I'm going to ask Ms. Sandos if she would give you a brief explanation of what that is. This is a compilation of changes to Title 8, which is your beer ordinance. Ms. Sandos?
Yes. I've got a brief slide that's going to highlight some of the major changes that you're going to be seeing with this ordinance. And Wendy, if you could bring that up. So while she's pulling up the slides, there are some significant changes, primarily to chapters 2 and 3. There are some changes in Chapter 1. You'll go to the next slide. The only changes that you're going to see in Chapter 1 are to the definitions. We are now expanding the definition of alcoholic beverages to include these spirits and liquor, and also adding in the definitions for a distiller and distillery. You'll see those changes as referenced in Chapter 3. Okay. You can go ahead. On Chapter 2, there are two major changes that are taking place. The first is the addition of the Special Event Series Temporary Occasion Beer License. What this is doing is allowing an expedited, more efficient process whenever there are events or event organizers that have groupings of special events that exceed the number 10 or more, that will take place within the city on a scheduled calendar. The license is going to be for the qualified applicants. Again, those are the bona fide charitable organizations, nonprofit organizations. Again, it's for no more than 10 events in a series. The events have to stay the same, meaning the footprints have to stay the same. Location of the beer areas have to stay the same. Type of event has to, in large part, remain unchanged. If there is a significant modification or revision, then it will be excluded and not eligible for the temporary occasion series license. These events are going to be limited to the areas of Founders Park, including the amphitheater, as well as the pavilion, and also to King Commons in the eligible areas. The fee is going to be set by the Board of Commissioners as evidenced on the application, as well as a fee structure and schedule that's going to be approved and presented annually. And there is not a reference to some certain amount in the ordinance. This was done, now this section was new, but there is a reference throughout that's an ordinance change throughout all of Title 8 that references some certain amounts for licenses. All of those are being changed to be a fee that is set by the Board of Commissioners annually. That was done in an effort to be more consistent with the other titles that we have throughout the city that are for fee and rental amounts. All right, move on to the next slide. The other significant change that's taking place with this ordinance is adding in a delivery service license. This delivery service license is primarily applicable to a very small subset of businesses and establishments. The state currently offers a delivery service license to businesses that can meet all the state requirements and can deliver for the establishments that derive at least 50% of their revenue from food sales and have a TABC license. The City of Johnson City has the authority to govern exclusively the establishments that for delivery service purposes that do not have a TABC license. To be eligible for this license, for the Johnson City license, you must hold a valid off-premise beer license issued by the city. Again, cannot have that TABC license. Again, the license fee, it's going to be approved annually by the Board of Commissioners, and there's a one-time initiation registration fee. Then there is an annual fee to be paid, as well as a fee related to the number of delivery drivers. And there are other qualifications and requirements that are going to be in that annual report that's going to be filed each year for the renewal. The next slide. The last significant revision included in this ordinance is the removal of language that previously prohibited distilleries as defined in Chapter 1 within the city limits. See the reference to the Section 3012 that amends that language that now authorizes state licensed distilleries to operate within the corporate limits for the city of Johnson City, as long as they are within properly zoned districts. And then the final revision would be to 309 and 310, which authorizes the city to inspect those and with the imposition of some fees for the inspections. Those are the highlights, the overarching broad points for the major revisions. If there are any questions? And
Any questions, commissioners?
I would make a motion, we approve this on first reading.
Okay. Motion is
I'll
motion
second
is
it.
second. Okay. Any other discussion? Ms.
I just,
Jennings?
I'd say, thanks to staff. I mean, this was a big undertaking to clean up a lot of things, make it more efficient. And I mean, this is definitely more efficient government with, less red tape for small businesses. And so great work.
And it's probably worth noting for those that this applies to, it's really just making the rules the same for that very small subset that already exist for all sorts of other similar and competing businesses. So this is really, I think, a sort of a leveling of the playing field.
Brings consistency now.
Yeah,
to
consistency. That's
Yep.
fair. Mm-hmm.
Exactly, right. Okay. Ms. Jennings?
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes, ma'am.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
The next ordinance is ordinance number 4749-20. An ordinance authorizing the conveyance to Ernest Campbell a certain parcel of real property owned by the city of Johnson City, located in the 9th Civil District of Washington County, Tennessee, upon the terms and conditions contained herein, and repealing all ordinances and parts of ordinances in conflict herewith. Ready for your consideration on first reading. If you will recall, there was a city-owned parcel located at 202 Highland Avenue that in a previous meeting, you approved Mr. Campbell's proposal to purchase that property for $15,001. And this is the ordinance that's required to transfer the real estate.
Move approval.
Second.
Motion and a second. Any further discussion? Ms. Jennings?
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Your next ordinance for consideration is ordinance number 4750-20. An ordinance to amend the zoning map of the city of Johnson City, Tennessee, being part of the appendix to ordinance number 1519, entitled an ordinance to adopt a code of laws and ordinances for the city of Johnson City, Tennessee, and to repeal all laws and ordinances in conflict therewith, and amendatory thereof by changing from R3 medium density residential district to R01 high density residential professional office district, certain properties located at 3706 Timberlake Road and 3806 Timberlake Road and 3808 Timberlake Road is ready for your consideration of first reading. This, as we talked at our Monday agenda review meeting, this is a request that was before the Planning Commission. The Planning Commission denied the request. The applicant appealed that decision to you. The Planning Commission denied this. This is a piece of property out on Timberlake that has existing multifamily on it. The petitioner desires to subdivide that lot. The existing density on the property does not meet the R3 zoning requirements. Therefore, if the property is subdivided as proposed, would require a different zoning designation for that property. Planning staff recommended denial of the recommendation based on the request for R01, because that not only allows high density residential, it also allows certain office and business uses. And obviously, when you make a change to a land use designation, there is no requirement that the existing use remain in effect. A future owner can always come in and change. That is strictly a residential area in the general proximity of this parcel, serviced by Timberlake Road, which is a fairly narrow residential street. It would not accommodate professional office or business type traffic in that area. Thus, the recommendation for denial of the request.
Commissioner Calhoun, was it a unanimous vote on the Planning Commission to deny this?
No, I think it was 5-2. Ason, you can correct me if I'm wrong. There was 5-2. And Paul, I think the Planning Commission was very sympathetic with the petitioner. It was, clearly a spot zoning and outside of the long-range plan of the city. And while there was no intent, I think, on the petitioner to move to a non-single family environment, that the change would not protect future owners.
Thank you for that. Appreciate it. Commissioners, are there any other questions for staff? Are you ready for motion?
Is the petitioner on the call looking to make their comments, or would we do that on public hearing? I guess I have reservations about contradicting staff and the Planning Commission for all the reasons that have already been said. I also feel like we owe it to the person who's brought it to us to at least hear them.
There's no one on the line.
Well, if we'd like to hear from the petitioner, we could certainly pass it on first reading and make sure they're present at second reading.
Or you could defer it.
Or we can defer it.
I'll make a motion to defer if Joe's interested, or if we feel there's need to hear from the petitioner. I mean, was there, from the staff perspective, did there seem like there was a desire to come and speak from the petitioner?
Yes, sir. I think I spoke with him just about an hour ago or so, and he indicated he will be watching, and if need be, he will call in.
Oh, so he said he might call in for this
Yes.
one?
Yes.
Okay. Well, Joe, what's your feeling there?
If you've made a motion to defer, I would second that and give them the opportunity to make their case. That they just need to understand it's a really high threshold for all the reasons we've just said, and we're going to need to hear something that counters that, or I don't know that the outcome will be different, but I want to give them a chance to make that case.
Sure, I understand that, and I mean, like you said, it would need to be extremely compelling of a case to because obviously this is, from what I've read, this would be a denial in my opinion.
All right, we have a motion and a second to defer this for 2 weeks. We'll have first reading again on the 20th. I think that's our date. Any other discussion? All right, Ms. Jennings.
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Your next ordinance is ordinance 4747-20, an ordinance to amend the zoning map of the city of Johnson City, Tennessee, being part of the appendix to ordinance number 1519, entitled an ordinance to adopt a code of laws and ordinances for the city of Johnson City, Tennessee, and to repeal all laws and ordinances in conflict therewith and amendatory thereof by changing from I-1 Light Industrial District to B3 Supporting Central Business District. Certain property located at 125 Lynn Road is ready for your consideration on third reading. And a song, am I correct that there have been no changes since the second reading?
Yes, sir.
All right. Do we have a motion?
Do we need the public hearing?
I'm sorry.
And it is public hearing. I apologize. Thank you.
I apologize too. Wendy, you've already indicated we have no one in the queue for calling in.
We need to have that Jeopardy music that plays
Yeah,
to run
yeah.
out the clock here.
So we have 2 of them for public hearing. That's
It's
right.
all the same. I'll leave the screen up for public hearing on these 2 unless Hassan needs it for his screen sharing as well.
No, ma'am, you can leave it up. I think we should be fine.
Okay, thank you. But I have no one on the line.
Okay, well, let's give maybe 30 seconds to see if somebody's calling in. Are there any other questions about this property? All right, and I did not open the public hearing, but I will open it. And if there is no one there, I will close the public hearing on 474720. Is there a motion?
Move to approve.
Second.
Second? A motion and a second. Any other comments or questions? Ms. Jennings?
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Your next ordinance is ordinance number 4748-20. An ordinance to abandon a public right-of-way between 1408 Virginia Street and 1412 Virginia Street upon the terms and conditions contained herein and repealing all ordinances and parts of ordinances in conflict herewith. Ready for your consideration on third and final reading. This is the abandonment of a platted but undeveloped public right-of-way. There is a water line through there, and we are reserving an easement of 10 feet on either side of the water line. The recommendation is for your approval.
All right, I will open the public hearing. Ms. Graham, is there anyone who has called in?
No, ma'am.
All right. Hearing no one, I will close the public hearing. Is there a motion?
Move approval.
Is there a second?
Second.
Any other questions, comments? Ms. Jennings?
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes.
Your next item for consideration is approval of an interlocal agreement between the City of Johnson City and Washington County E911. This is an interlocal agreement we enter into each year after the approval of our budget. What this does is memorialize the agreement and the allocation from the city to E911. In your budget, you approved a total annual payment of $900,000 to the district to be made in quarterly installments of $225,000 each. And agreement in exchange for the payment, dispatch services shall be provided by the district for police and fire. And this is a standard agreement we do every year, as is required by TCA 129101. We would recommend your approval.
All right, commissioners?
Move for approval.
Second.
Motion and a second. Any further questions? Ms. Jennings?
Commissioner Calhoun,
Yes.
Commissioner Fowler,
Yes.
Commissioner Hunter,
Yes.
Vice Mayor Wise,
Yes.
Mayor Brock.
Yes. And you know, there's a lot to be proud of for our 911 and the work that they do. So they have a nice facility now that we've had an opportunity to spend time with them on. So we're very grateful for all the work that they do for the citizens of our communities. All right, that's our last item. Mr. Peterson, is there anything else you have for us?
There's public input on your agenda.
I'm
If there's
sorry. Well,
anyone out there that would like to speak?
is there anybody, Mrs. Graham?
No, ma'am.
Okay, we will not have public input tonight.
A couple things I would bring to your attention. We have reallocated some personnel to work with our codes enforcement group. We've got codes enforcement and these new personnel that are going around the city visiting businesses to observe their adherence to the mask mandate and to communicate with them about how business is. Do they have any, is there anything that we could do to help them and to be successful with their business? We're supplying them distancing stickers to be placed on the floor and stickers to put up in their windows to remind people to wear masks and trying to answer questions. That's been a very successful program that's been up and running full speed this week. And so far, from what the reports I've gotten, we're getting probably a 95, 98% compliance based on all the businesses. They've looked at businesses, concentrated on business visits on north state of Franklin, the downtown area, some over on south state of Franklin Road. I've asked them to visit the businesses that have high traffic volumes first. So it's been well received by the businesses. I think they're thankful for the visit and for the opportunity to communicate and any guidance that we can give them. As was reported in the paper, we have had multiple employees in our development services group put into quarantine due to or self-isolation as a result of being exposed away from work. We have closed down the entrance into development services to prevent our existing remaining staff from potentially being exposed. Some of those folks are being released out of isolation to come back to work now. We have been blessed to this point that we are unaware of any transmission of the COVID virus within the work environment. The exposures have been in situations away from the work environment. The employees are very conscious of wearing masks, social distancing, proper hygiene, and that's something that we remind them of on a daily basis, that for their good and for out of respect to other people to be compliant with all the directives with safety precautions. So we got a number of projects underway. We've got a couple of projects completed, as Commissioner Hunter pointed out the other night. The Baxter Street Bridge is now completed. Public Works crews continue to work on the Adventure area down on Millard Street. They've got the play equipment is on order. That's moving along. The development out behind the mall is progressing very nicely. There's a street extension that is nearing completion out there on that. So we've got multiple water sewer projects underway, and those are progressing rather nicely. So even though we've had COVID challenges and multiple other distractions over the last 4 or 5 months, staff's done a great job of keeping projects moving to get uninterrupted service delivery of the quality that we are used to and expect out of our folks. And a great big thank you and a note of appreciation to all of our staff members here. They've stayed focused and worked real hard to keep things moving and keep them moving in a positive direction. So a lot to be proud of.
Commissioners, we usually people give us formal report at our next meeting for any committees that you've been attending on behalf of the commissioner. Are there any updates or information you'd like to share?
Planning Commission is still looking for that Washington County representative. We thought we had one candidate, but they live just outside the appropriate zone. So we're still looking for that one candidate.
Okay.
I met with the CVB this afternoon, and they are getting a plan together to come back and let us know what they think they would like to do. And I think the chamber has done the same thing. So hopefully soon we will get some information about how they'd like to proceed forward and see what we can come up with to help them with whatever they decide to do. And then hopefully we can get together and decide what we would like them to do. So it was a good meeting today. They had a lot of good input. A lot of the hoteliers were there and had some good input. So hopefully that decision's been made by both groups and bringing that to us soon.
Joe and I sat in on the TIP advisory board earlier this week, right, Joe?
Yesterday, I believe it was.
Yesterday, man. time's been slow this week. There were a couple of projects, and Joe wants to go into greater detail on them. He can. I guess the main thing was the update to, it's not the bylaws, is it? What was the document called? The TIP agreement?
Oh,
Redevelopment plan.
The redevelopment plan, correct. But Joe, if you got anything else to add?
no, JCDA has been fairly busy. There was the TIF advisory meeting the other day. Of course, JCDA's moved its office last month. It's now in the Taylor Building, Property Experts Building. The JCDA has had several calls this week centered around the disposition of the John Sevier Building and creating new or alternative housing for the residents there. So there's a lot happening. That's going to be a slow process, but certainly lots of activity in the last 10 to 14 days on that front.
Okay. For me, let's see, on Bright Ridge, we'll tell you they are fast working on a second solar development that may be out in the Limestone area. And the primary use of the power generated there would be for the Washington County, Johnson City, and ETSU. So it would go to support our school programs, as well as adding a STEM component that they could work with the schools on. So that's exciting. That will, if everything can be worked out, would be operational by December of 21. So working on that. Of course, the rollout of broadband still continues, and there have been a number of things to expedite some areas. Jeff Dykes has just applied for a fairly sizable grant through some of the stimulus monies, and particularly with our children really needing access to broadband in order to do the distance learning as we are right now. I think if even one of these comes through, and there's a pretty good chance on it, it will really help enhance that to target those young people who may be in lower income areas that may not have it. And they're looking in short term of actually just building some Wi-Fi free zones where at least they could go upload or download, their lessons and upload the work that they've done. So really good work from the Bright Ridge folks. The animal shelter remains closed to the public except by appointment only. And we are waiting for one test result of an employee there right now. So, there you go. At least I don't think the animals can get it. So, but we have been controlling intake and then having appointments for adoptions. And quite honestly, the adoptions have gone very well, even by appointment. So,
Mary, you may not know off the top of your head, but I actually had a question from somebody today about food donations. Is there a drop-off point, or
yes,
what do I tell people?
The shelter's still staffed. I mean, they have to take care of all those animals. So if they would just bring it to the intake office, which is at the west end of the building, just drive on past, and then it's right there on the end. More than happy to take it. Yep. We'll take any donation out there. Yep. Blankets, beds, food, money. Anything else? All right. Been a fast and furious couple of weeks here. So we will see everybody again on what's our next date? The 20th? Have our agenda review meeting on that Monday before. If there are any items you'd like to get on the agenda review, let's go ahead and get those to Pete and give him a chance to start prepping for them. And other than that, our message to the public, wear a mask.
And if you haven't voted, you have 24 more minutes.
Forgot about that. Yes. Yeah. So the election finally came. Thank goodness. Yeah.
The mail will stop coming.
All right. Very good. All right. Meeting adjourned.
Thank you.